debates taking place currently around what should happen with education. One gets the sense that we have a private sector, private institutions that are ready to go as of whenever the minister gives the go-ahead, whereas your public schools are in a far different situation to that. As Section 27, what are some of the concerns that you have in terms of the approach that the Basic Education Department is taking right now?
Thank you very much, Cathy, for having us on your show, and to just say that I am neither an education specialist nor a public health specialist. So we are not Dr. Fauci's or Dr. Abdul Karim's. What we are lawyers that protect human rights. And so far, the right to basic education has been limited because of the pandemic. And it's a reasonable and justifiable limitation of the right to basic education. But as we open, or as the minister makes the decision to open, we have to make sure that that happens in a way that doesn't impact more on the right to basic education or other rights, like the right to health or the right to sanitation or the right to food. So what we have been asking for is that the minister, and I think not just human rights organizations like Section 27 Equal Education and the Equal Education Law Center, but today the trade unions, all the teacher trade unions also put out a statement saying what they would like is for the minister to take us all, the public, parents, educators, learners, into their confidence. We need to know what the best available medical evidence says about infections and transmission among children and all of that, and how that will translate into policy. Now, there have been many things that have been said about what government has made many undertakings about what they're going to do in terms of social distancing. That's in terms of classrooms. There's a minimum of 40 learners per classroom. They're going to provide 400 mobile classrooms. There's going to be social distancing in the scholar transport. So we need to know a few things about social distancing, for example. We need to know that a minimum of 40 is reasonable. It still seems like a pretty big class. And considering how many schools are overcrowded in the country, we need to know that 400 mobile classrooms is enough. The other thing we need to know is that when schools do start reopening on the 1st of July, or when learners start entering, that the school is going to be ready for that, and it's going to be ready for some of the hygiene and sanitation issues. So I read a piece in the Times yesterday that said Limpopo, there hadn't even been procurement around masks. So that's a concern. If we don't have these basics in place, learners cannot go back to school on the 1st. We are not saying we want schools to stay closed or we want schools to open. What we are saying is we want transparency around the information that policy and undertakings are based on. And we want to be able to engage the department on that, as would educators and parents.
Sure. It's interesting because you raised the issue of transparency, and what we've seen from government in their approach to COVID-19 is that the impression one gets is that they've been trying to be forthcoming. They've been trying to give the public as much information as possible. But clearly, there are instances where that is not happening in the full extent to which it can happen.
Yes. Look. Let me just say that we started, and we are on a similar timeline to Russia. And if you look at what's happening in Russia, there are 250,000 infections, and some people say much higher. So we need to congratulate our government. We need to pat them on the back and say they did a good job in closing down when they did. But something like school openings is such a vexed issue. Not just in South Africa, but all over the world. It's a debate. The medical science on this, it does seem like younger children are less likely to get sick and less likely to transmit. But there's also new things coming out like, for example, the Kawasaki syndrome in New York, that's affecting many children in New York. So when they say that we are going back to school and this is what the medical science says, we need to know who says it. We need to know, and we need to know that there's more collaboration between the unions, between civil society, and there isn't just a top-down approach in telling us what they're doing, but there's an engagement in what they're doing. There's time for question and answers. And I think what people are saying is that they haven't had enough of that.
All right. Faranaaz Veriava from Equal Education. We're going to have to leave it there for tonight. So